Most people believe more medical testing means better health, but after 70, that belief can quietly start working against you. There's a point where just checking can trigger a chain reaction, one that leads not to peace of mind, but to stress, complications, and sometimes even life-altering consequences. And the uncomfortable truth is many people don't realize this until it's too late. Imagine this. You feel completely fine. You're active, independent, enjoying your daily routine. Then during a routine doctor visit, you're told, let's run a few tests just to be safe. Seems harmless, right? But weeks later, you're dealing with follow-ups, then procedures, then side effects, and suddenly, your quality of life has changed in ways you never expected. Have you seen this happen to someone close to you? Or maybe even experienced it yourself? Because today, we're going to walk through something most people are never told clearly: the hidden risks of certain routine screenings after age 70, and how to make smarter, safer decisions about your health. But here's the part most people overlook. The way medical screening works changes as you age. In your 40s or 50s, screening can be life-saving. You catch something early, treat it, and you've got decades ahead of you to benefit. But after 70, the equation shifts. Some conditions grow so slowly they'll never actually affect your life. Your body becomes more sensitive to procedures, and small findings can trigger what doctors call a cascade, one test leading to another, then another, until you're caught in a loop of interventions you may not have needed in the first place. Let me tell you about Margaret. She was 78, sharp, independent, walked every morning. No complaints, no symptoms. But during a routine visit, she was advised to get a colonoscopy. She hesitated, but trusted her doctor. The preparation alone left her severely dehydrated. She ended up in the emergency room before the procedure even happened. And here's the deeper issue. After a certain age, the risks of routine colonoscopies can outweigh the benefits, especially if you've had normal results in the past and no symptoms. The preparation can strain your system, sedation carries risks, and in rare cases, complications like bowel perforation can become life-threatening. Now think about this. If a test meant to keep you safe ends up putting you in the hospital, is it really helping? This doesn't mean colonoscopies are bad. It means context matters. If you have symptoms, absolutely investigate. But if you're feeling well, with no warning signs, it's worth asking if less invasive options could give you peace of mind without the same risks. And that brings us to something even more surprising: cancer screening. Now this might challenge what you've always believed, because we're taught early detection is everything. And in many cases, it is. But after 70, not all detected cancers are dangerous. Some grow so slowly that they would never affect your life. But once they're found, they're almost always treated. And treatment can come with serious consequences. Let me paint a picture. An older man goes in for a routine blood test. His PSA levels are slightly elevated. Next step? A biopsy. Then a diagnosis: low-risk prostate cancer. Now he's faced with surgery or radiation. Months later, he's dealing with complications like incontinence or loss of sexual function, all for a cancer that may never have caused him harm. Take a moment and think about that. Would you want to treat something aggressively if it wasn't going to impact your life in the first place? This is where many men over 50 start asking deeper questions about prostate health, testosterone levels, and long-term vitality. It's not just about living longer. It's about maintaining quality of life. The same goes for breast cancer screening in older women. Some detected tumors grow so slowly they never become dangerous, but the treatments, surgery, radiation, chemotherapy, can take a serious toll. So instead of blindly following routine schedules, it becomes about personalized decisions. Now here's another one that often catches people off guard: heart stress tests. It sounds like a smart move. Let's check your heart, just in case. But here's the twist. In people without symptoms, these tests often produce false alarms. That maybe something's wrong. Result leads to more invasive procedures, like catheterization or even stents. And large studies have shown something surprising. For many people with stable heart conditions, these procedures don't actually reduce heart attack risk compared to medication and lifestyle changes. So you go from feeling fine to undergoing procedures, taking additional medications, dealing with side effects, without a clear benefit. Let that sink in. Have you ever done a test just to be safe and ended up more anxious afterward? Now around this point, if you're finding this eye-opening, If you're enjoying this and want more practical health tips, don't forget to subscribe and join our growing community. Because understanding your body, especially as you age, is one of the most powerful things you can do. Now let's talk about something many people worry about: bone health. Falls are a real concern, especially as we get older. So it makes sense that bone density scans are commonly recommended. But here's the nuance. The scan itself isn't the issue, it's what often comes after. Medications used to treat low bone density can have long-term side effects, including rare but serious bone complications. Meanwhile, the most effective way to prevent fractures isn't always medication. It's practical, everyday changes. Improving balance, removing tripping hazards at home, strengthening muscles, checking vision, reviewing medications that cause dizziness. These small steps often do more to prevent falls than any prescription. Think about your own environment for a second. Are there simple changes you could make today that would reduce your risk? Sometimes the most powerful solutions are also the simplest. And now, this next one might surprise you the most. Screening for blocked neck arteries. It sounds logical, right? Check for blockages, prevent a stroke. But in people without symptoms, this screening can lead to surgeries that carry their own risks, including stroke itself. Imagine going in for a routine scan, feeling perfectly fine, and coming out of surgery with the very outcome you were trying to prevent. It's rare, but it happens. And this is why many experts recommend against routine screening in people without warning signs. So where does this leave you? Not confused, but empowered. Because the goal isn't to avoid healthcare. It's to make smarter decisions. Here's a simple framework you can start using immediately. Next time a test is suggested, pause and ask, what are we looking for? What happens if we find it? What are the risks of treating it? And what happens if we do nothing? These questions shift you from passive patient to active decision maker. And that's where real health control begins. Where are you chatting from? Drop it in the comments section. I always love seeing where this community is tuning in from, and it reminds us we're all navigating these decisions together. Let me share one more story before we wrap up. A man in his late 70s, active, independent, enjoying retirement. He went in for a routine screening. That single test led to more tests, then surgery, then complications. Months later, his biggest regret wasn't what they found. It was starting the process in the first place. And that's the heart of this conversation. More testing isn't always better. Better decisions are. You deserve healthcare that protects your life, not just extends it. You deserve to feel strong, independent, and in control, whether you're in your 50s, 60s, or well into your 70s and beyond. And if you're focused on things like boosting energy, maintaining strength, supporting hormones, and improving stamina, those daily lifestyle choices often matter far more than any screening test. Movement, nutrition, sleep, connection. That's the foundation of long-term vitality. So don't let fear drive your decisions. Let understanding guide them. And if this perspective helped you today, if you're enjoying this and want more practical health tips, don't forget to subscribe and join our growing community. Because here, we focus on what actually helps you live better, not just longer. This is Dr. Alex with the Healthy Body, and I'll see you in the next one.